Essentially because occupational therapy focuses on the overall person, whether it's like a physical, mental, or even like a social disability or something that impacts their ability to function daily. That is the focal point of occupational therapy. So when you're working with these individuals, knowing that just as simple as it is for me to get up and brush my teeth, that may be a huge struggle for somebody else. You're working with them to improve those deficits so they are able to function as normally as they can. So I like the labs for the classes because in lab, you're doing hands-on applications. So everything that you've learned in lecture, you're now able to execute that with your classmates, mocking as patients with different case studies. Now you have to play practitioner and therapist with these patients that are your classmates in lab. Part of the occupational therapy assistant program, you are required to complete what they call field work. It is definitely essential to have that experience because that allows you for sure to have a light bulb moment when you're seeing a patient in real time and this is not your classmate. This is a complete stranger with a caseload and a diagnosis that you have to figure out the appropriate way to help them help themselves. You could work anywhere as far as school-based, school district, a hospital, an assisted living, a skilled nursing facility, rehabilitation centers. I mean, I could continue to go on and on. You have to consider that occupational therapy is needed when an individual has deficits that impact their ability to be functional. So that's a wide range of ages. If you think about that and you consider that, that should give you somewhat of an insight of how many opportunities it truly is for an OTA.